Good morning, good afternoon, good evening, wherever you are joining us from. Thank you for making the time to attend this webinar, which is broadly exploring the neuroethics landscape in Africa, the global south, and also globally more generally. And we're trying to, we hope to get a handle of some of the exciting conversations and opportunities for formulating a research agenda in that space. My name is Anya Nyamjo. I'm a senior research officer here at the EthicsLab. And we are co-hosting this event with the Genomics of Brain Disorders unit, which is based at the University of Stellenbosch and is one of the South African Medical Research Council's extramural units. The webinar falls broadly as this webinar is part of the EthicsLab's research development program, which tries to foster engagement around how the African humanities could inform the ethical questions posed by new and emerging health technologies. For the most part, we've spent time thinking largely around artificial intelligence. So this webinar represents a departure from that to try to think about other technologies that are impacting what we make of the human condition in a digital age. And the hope is that these conversations are just a start of a much broader exploratory set of conversations going forward. So a few housekeeping I guess rules, or for lack of a better term. This webinar is being recorded. I do hope that doesn't disincentivize our guests, our attendants from putting on their cameras, especially when it's time for the question and answer session and the discussion following the presentations. And in terms of how the discussion will unfold, I'm going to cede the floor to Olivia, who is from the University of Stellenbosch, Dr. Olivia Machabane, who is at the Genomics of Brain Disorders unit. She will introduce our panelists and get the discussions going. And then after that, we're going to have a question and answer session. So on that note, Olivia.
Thank you, Annie. Thank you. It's such a pleasure to be here today. And I'm very excited about this discussion that we're about to have and this opportunity to engage with these amazing scholars in the field of neuroscience and neuroethics. And as mentioned, my name is Olivia Machabane. I'm a neuroethics researcher in the Department of Psychiatry at Stellenbosch University. I'm based in the South African Medical Research Council's SU Genomics of Brain Disorders unit, which really is a unit that aims to identify genomic biomarkers using systems biological approach and looks at various brain disorders, understanding how they come about and looking at effective treatment methods for these conditions. My work is really around neuroethics and expanding the work of the unit to think about ethics of neuropsychiatric genetics, but also ethics of neuroscience and neurotechnologies. And the unit is led by Professor Soraya Sidat and co-directed by Professor Sean Hemmings. So now I'll just move on to introducing our guest speakers today. And I'll start off with Assistant Professor Damien Eke, who is an assistant professor at the School of Computer Science at the University of Nottingham in the United Kingdom. Damien was the data governance coordinator for the EU Human Brain Project, and he serves as the chair of the Data Standards and Sharing Working Group of the International Brain Initiative. He's one of the PIs on the Wellcome Trust-funded project Bridge, which aims to develop an international data governance framework for neuroscience. He's the founder and director of the African Brain Data Network, and he has extensive experience in developing data governance strategies and frameworks for neuroscience research and practice. He teaches data governance for brain research at the NIH-funded summer school, Neuroacademy. I had to practice this. Hosted by the University of Washington in Seattle. And his research interests cover critical philosophical issues at the intersection of technology, data, and society, including neuroethics and ethics of AI. So welcome, Damien. Thank you for joining us. And then I move on to Dr. Jasmine Kwasa, who is an NIH postdoctoral fellow in the Neuroscience Institute at Carnegie Mellon University in the United States, and currently a US Fulbright Scholar in Nairobi, Kenya at the Aga Khan University. As a neuroethicist, Jasmine writes about the future of inclusive medical devices and the history of racial bias in neuroscience, medicine, and technology. She's also the Chief Technology Officer of Precision Neuroscopics, where she's commercializing EEG solutions for people with Afro-textured hair. And I also happen to know that Jasmine is also the 2024 winner of the Nomis and Science Young Explorer Award for her work on inclusive neurotechnologies. Welcome, Jasmine, and congratulations.
Thank you.
So, and then we have Professor Diego Borbon, who's a professor at the Center for Studies on Genetics and Law, director of the research group in Biological Sciences and Law at Universidad Externado de Colombia, and he's founder of the Ibero-American Network of Neurolaw and Neuroethics. He's also a member of the governance and the student and postdoc committee of the International Neuroethics Society, as well as executive member of the Foundation for Applied Neurosciences in Law. He's founder of the Observatory of Neurolaw and Criminology and honorary member of the Colombian Association of Criminology. Welcome, Diego. Thank you for joining us.
Thank you.
Finally, we have Assistant Professor Catherine Basel, who is an assistant professor in neuroethics at the University Medical Center Utrecht in the Netherlands, and a Niels Stensen Fellow at the Technical University of Munich in Germany. In particular, she's interested in the ethical implications of neuroscience models, implantable neurotechnologies, digital technologies for brain and mental health, predictive biomarkers in psychiatry, public participation and involvement in research, and science and ethics communication. She's the founder of Neuroethics Today, which is an educational platform aimed at raising awareness on the ethical and societal implications of neuroscience and neurotechnology and democratizing neuroethics literacy. So welcome, Catherine. Thank you for joining us.
Thank you, Olivia.
Wonderful. So thank you to everybody who's joined the call. And I would also like to just invite you to, as the speakers are going through and we're having the discussion, to pop your questions in the chat so that we can also address them as the conversation is going on. But as Anya mentioned, there will be an opportunity for the audience to ask questions and to put on their videos if you would like, and ask your question to the speakers. And then also, if you are able or interested, you're also welcome to let us know where you're joining us from in the world in the chat. That would also be quite nice to know. So we're going to start off with the first question, and I've spoken a little bit about the backgrounds of the speakers, but I'd really love to hear from them if they could share their journeys and why they became interested in neurotechnologies and neuroethics, which will bring us to how we came about together in this discussion. I will start off with Damien. Thank you.
Okay. Oh, thank you very much. Just as you pointed out, my work in neuroscience revolves around data governance and ethics of neuroscience or neurotechnology, because my background is in philosophy. So what is a philosopher doing in neuroscience? What is a philosopher doing in the midst of scientists? So my work started as a data governance coordinator for the EU Human Brain Project, which is a project or a 10-year project in Europe, maybe one of the biggest in the world, that had over 130 institutions as part of the project and over 500 researchers as part of it, and generated enormous amount of data in Europe and beyond. So my work revolved around building data governance frameworks to make sure that ethical and legal issues around data, brain data or neuro data were actually addressed. So in the midst of doing that, being an African in Europe doing this work, it was very evident that most of the things that we were talking about, or the issues that were being discussed, we in Africa are also evident, but maybe we have not developed robust frameworks to address them. So that's how I got interested in my recent work in Africa. So most of the things that we were addressing, seeing issues of privacy, issues of incidental findings, are also not unique to Europe, but also things that can come up in all parts of the world, and hopefully in Africa, we can now start to discuss and address some of these issues.
Wonderful. Thank you so much, Damien. I'd like to move on to Jasmine. Could you please share with us?
Sure. Hi, everyone. I'm Jasmine. Olivia, thanks for the wonderful introductions and for inviting us to this. This is a great group of people, so I'm excited. So I trained as a medical engineer, electrical biomedical engineer. And although my training was very much about building things for medical science, my PhD ended up being a lot about the basic science of auditory attention. And I used EEG, which is a non-invasive, brain wave modality. And it's become popular even in, consumer technologies. People just throw a little cap on their head and you can infer things about your mental state, like attention or focus. And so when I was doing the EEG studies, again, not inventing EEG, just using it, I realized that there was a big lack of people with coarse and curly hair, people with Afro-textured hair in the sample. And it was kind of a funny story. My aunt and mom came to my graduation and were like, you should do it on us, do EEG on us. And I was like, oh, it's going to take too long. Your hair it won't work. And that's when I realized, oh my goodness, there's a systematic problem with some of the neurotechnologies that we use. And so with my background in engineering, I thought, okay, I can probably do something about this. And so I joined a lab that was already working on what we call an inclusive EEG electrode, which attaches to the scalp using the strength of Afro-textured hair in braids, and helps make sure that electrical activity can efficiently get from the brain and into the computer where you need to analyze data. So now that's what I do, and I try to commercialize these products that we've developed and designed and brought forth. But I noticed it's not just EEG; it's the whole system of us creating technologies, medical technologies in general, have a lot of bias in it, and I can talk about that later. But it's really about who's designing these products, who are they made for, who has access to them. And so I didn't really know what neuroethics was until I started to write about it with some other neuroscientists and engineering friends. And now I'm like very deep into it. I'm a member of the International Neuroethics Society, which you've mentioned in the intros. And I've even worked with the Harvard Center for Bioethics on talking about what we call neurotech justice. So what does that look like and what does it mean? So we work with lawyers, engineers, doctors about how to define what justice looks like in the neurotech space. So it all came to me, I won't say in a dream, but through lived experience of seeing how people who look like me get excluded from some of our cutting edge neurotechnology studies.
Wonderful. Thank you so much for sharing that with us, Jasmine. We'll come back to the justice topic, I think, throughout this discussion, because I think that's definitely one that's cross-cutting and really important for this work. So I'd like to move on to Catherine and to ask you to please share, based on your background and just adding on to the discussion, how you came about this field and your area of focus. Thank you.
Thank you, Olivia. Yeah, I think for me, a bit similar in some ways to Jasmine's experience is that I do not necessarily come from a background of ethics or bioethics, but I'm actually a biologist by training and a neuroscientist by training. But I think it was throughout my work and my education, my early education as a neuroscientist, that I started to become curious about the impact of my work, the ethical impact of my work, and the implications that arise from my work. And so, one particular focus that I had during my master's and PhD was looking into biomarkers for stress-related disorders, such as post-traumatic stress disorder. And of course, looking into more fundamental biological mechanisms was, of course, interesting in and of its own, but I kept on being kind of curious about what does that mean in practice? What would it mean if we are one day to really make use of these biomarkers to identify individuals that have a certain susceptibility to certain psychiatric disorders or stress disorders like PTSD? And of course, this led one question to the next and really kind of moved me into exploring more the field of neuroethics. But I think one other thing beyond looking at the ethical, legal, and social implications of neuroscience research in particular, I was also kind of surprised at the lack of awareness within the neuroscience community. So looking at colleagues, but also professors of mine that at the time had no idea what neuroethics was and could not really kind of reflect beyond animal research ethics when the term ethics would come up in relation to their research. And I think this really, I found that problematic at first, but also I thought that was an opportunity for me to probably try and fill that gap. So today, as working as a neuroethicist, but really where my scholarship focuses on not only looking at the implications, the ethical implications of neuroscience and neurotechnology, but also trying to bridge the fields of neuroethics and neuroscience by raising awareness among neuroscientists about why they should think beyond the scientific impact, but also think of the societal value and the societal impact of their work. And I think this also very nicely leads to one of my initiatives, which is Neuroethics Today, where I really try to push forward the idea of, on the one hand, we have science communication, which is very important, and it's breaking down some of these complex, cutting edge breakthroughs in neuroscience to the general public. But I also think we should have something similar and in parallel, where we should be breaking down and explaining to neuroscientists, but also the general public, what do we mean by neuroethics and what do we mean by ethical issues and ethical concerns that relate to emerging neurotechnologies.
Wonderful. Thank you so much, Catherine. And I think that just ties in the discussion so beautifully. I'm going to hand over to Diego to speak about his experience and how he came into the field of neuroethics and neurolaw.
Thank you, Olivia. So my background is especially in criminal law and criminology. So from there, I got into legal psychology, mental disorders, mental health, because I always found that human behavior and the scientific study of human behavior was especially interesting. Upon then, I got into the problem of free will, which is basically what my PhD thesis is on. Free will, mass incarceration, penal abolitionism. And one day when I was researching about free will, I heard that someone was proposing a new list of human rights to regulate neurotechnology, and especially a new right under the label of free will. So I got interested in what neurorights were, and upon then neuroethics and neuroethical discussions of neurotechnology and regulation. And especially since Latin America has been the pioneer region on neurorights legislation. So, for example, the case of Chile in 2021, and now currently we have, for example, in Mexico, 4 initiatives, Brazil has 5, Colombia has 2, Argentina, Chile, and other Latin American countries have a lot of new proposals for regulation of neurotechnology. Unfortunately, I have seen many drawbacks, and we're gonna get into it later. So we are currently leading some research on critical perspective against neurorights, as some problematic proposals have been arised. So currently, for example, I'm very interested in how neurotechnology can be applied to law and what are the ethical concerns on it. For example, in criminal law, some applications of neurotechnology allow, for example, non-consensual coercive interventions aim for moral enhancement or clinical applications without the consent of the people, or for example applications for evidence assessment in lie detection or prediction of recidivism or violent crimes. And finally, we're currently having some interesting initiatives here. For example, our Latin American network on neurolaw and neuroethics, where we have more than 35 experts and universities all across Iberoamerica, where we basically study, research, and promote the dialogue and foster collaboration in neurotechnology regulation and neuroethical discussions. So that's basically it.
Wonderful. Thank you so much for sharing. That's really great to hear about, the developments that have been happening, a lot of them being coming from America, and how you're thinking quite critically about those developments and their contribution to this discussion in the field. And I think that brings me to the around how do you think scholars, individuals based within the Global South and in Africa and other Global South contexts could actually contribute to the global discussions on neuroethics and neurolaw. And I'm going to start off with Damien to ask if you can maybe share some of the ways in which you've been thinking about this and ideas or suggestions that you think would be applicable from your vantage point. Thank you.
Okay, thank you very much. And it was also very interesting to see here the entry points for all of us into neuroethics and the discussion on neurotechnologies. I think what is happening before we talk about the contributions from the scholars from the Global South, we need to understand the landscape of the discussion at the moment. From my perspective, not just in neurotechnology, but all the aspect of the emerging technologies, the voices from the Global South are maybe missing, sometimes forgotten in the discussion, and some have framed this as epistemic injustice. So it is important for us to start understanding that the perspective from the Global South is also very relevant to the discussion on ethics of emerging technologies, not just neurotechnology, but also AI and the like. So if we understand that there's epistemic injustice, we need to then ask ourselves, how can we achieve justice in this space? First of all, we need to start doing the things that we are supposed to do as the Global South. Start doing taking ownership of the research that is happening in the Global South. If we take ownership of the research, we'll have ownership of the data, and then we'll control the narratives of what is happening in the Global South. Exactly what you're doing now, Olivia, in South Africa and in Africa in general, taking up some of these discussions, understanding what is mapping the landscape ourselves, so that we don't allow voices from the global north to map the landscape for us. It is important for us to do that, to start from what we are trying. One thing that usually happens is when we want to do this, we seek for funding from outside of the region. And when this happens, the person who pays for the research can control the narrative of the research. It's important for us to understand how to, even though even if we collect money or grants from the global north, it's important for us to maintain ownership of the narrative, ownership of the data. That is important. From my perspective on data governance and also the policies, it is important for us to own the data, our data. It is important for us to have control of the data. In law, maybe Diego would talk about data ownership. It's diverse in different regions, but taking control of the data, controlling the purposes and processes of the data is important in our region. If we do that, I think our voices, our narratives will be heard.
Thank you. Thank you very much. That was a really powerful contribution to the discussion. And I think it kind of takes us back to actually thinking about, as you mentioned, what is the actual landscape? What are the discussions on ethics of neurotechnologies and neuroscience? And I like going around epistemic justice and how we need to be leaders, I guess, of the narratives around neuroscience and neuroscientific technologies being used in our contexts and in context in general within the global South. I think I'm going to ask Catherine if you could perhaps give us a quick kind of overview on what the key issues are or discourses are in the context of neuroethics for the greater audience, to just get a better sense of what are the issues that we're grappling with in this discussion.
Yeah, thank you, Olivia. And I also want to thank Damien. I found that really a very important contribution, especially about how we set the roles and responsibilities of different scholars or different countries in the conversation about the ethics of neurotechnology. I think one thing that I would like to focus in particular on when it comes to discussing the impact and the implications of neurotechnologies is this idea or concept of neurohype. And I would like to discuss it also in two different context. One, when we discuss neurohype, that relates to the promises of neurotechnologies, but I also want to talk about neurohype when it concerns hype about the ethics and the implications of a technology. And I think here I could also probably give an example that Diego might also have a few things to say about, and especially when we're looking at this rise and pushing towards neurorights in order to protect against the risks that accompany emerging neurotechnologies. I mean, if I start with the first one, neurohype, and concerning the promises of neurotechnologies, I think we see a lot that with these cutting edge technologies really coming at the forefront, and we're seeing a lot of advances and a lot of tools that are being developed either in the medical sphere but also in the consumer sphere. We see that there are indeed a lot of promises, but I think the way many times it is communicated to the wider public is that we are already there, is that the promises or that the potential of this technology has already reached, whereas we know that we are still in the very beginning phase, and there's still a lot for us in terms of the reliability of the technology, the validity of the technology that still needs to be further tested before it is really able to help a large group of patients at first, but also probably larger groups later on. And I want to give one example which does not necessarily pertain to a neurotechnology per se, but is a technology or a tool that can be used for individuals that are, for example, suffering from certain mental illnesses or are in need of certain mental health support. And one example is AI chatbots. So we have heard a lot of digital mental health tools, including AI chatbots, that can really help and provide a lot of positive assistance for individuals that would rather not have access to mental health resources in their areas. But of course, we are seeing with these advanced AI chatbots, such as large language model-based chatbots, that the risks in many cases are outweighing the benefits, and especially with recent, such as a Belgian person a few years back that committed suicide, but also a recent case in the US of a 14-year-old boy that also committed suicide. And I think this showcases that, yes, on the one hand, we do have a lot of promises that these technologies are bringing, but they also come with a lot of risks that sometimes need to be particularly taken into account before we start hyping up or discussing only how promising these technologies will be to a large group of individuals. And then to move on to the other context, which is really looking at hyping up the risks, I also see that there are dangers and of course, this is something that we as neuroethicists or those focusing on the ethical implications could also be kind of at fault of when we are trying to share and communicate to different audiences what are some of the ethical issues that we should be concerned of, we can also hype up these issues and these risks. And in turn, we can probably even lead to some fear-mongering narratives that are associated with neurotechnologies, but also when we see how this push and movement towards applying or introducing neurorights or rights for protecting against emerging neurotechnologies, we also could start seeing this or kind of pushing a narrative that this is going to be the solution to many of the issues. And this, I believe, can be very reductionist, and could also kind of put a lot of effort into pushing for neurorights and not think of other solutions that might be more pertinent, especially when we are looking at who are those that are going to be probably suffering from the risks of these emerging technologies on the short term. And that, of course, is patients and not necessarily the general public at the moment.
Wow, that was a very rich contribution, and just brings to the forefront so many issues that we need to be considering when it comes to these neurotechnologies. And I think it segues quite well to a question that I have for Jasmine around biases in these neurotechnologies, and even in the context of detecting if some of them do mental health conditions. I mean, you mentioned differences in terms of how effective they can be with different textured hair, Afro-textured hair, for instance. So how do you think about these, particularly when it comes to serious things such as, the risk of suicide, or, the risk of any kind of self-harm or community harm or individual harm? Is there any insights that you could share with us, Jasmine, and any, things that come out, that emerge from the literature, from your work, that you can share in this regard, and anything else?
Yeah, everything that's been said so far is 100% in line with what I've been thinking about. You all obviously have more technical words for it, but just what I've seen, yeah, I can speak to the biases that exist in these tools. It's very clear in the literature that, especially for AI, that there's bias, right? Depending on who makes the tool will determine who it works for, right? And so this has been a problem in AI for a long time. There's the fair AI movement, which is really there to stop some of the harms that come from these biases. In my field, with EEG, working with coarse and curly hair, we've kind of deemed it phenotypic bias. So you have coarse and curly hair, that's not going to work as well with something that goes on the scalp. But there's even what I like to call the new MRI. So there's a device called FNIRS, functional near infrared spectroscopy. And if you're familiar with optical technologies, infrared light, it's light. So it goes, again, on the scalp, and it shines light into the brain. And when the light comes out on the other side of the brain, or on the other side of the scalp, wherever that might be, you can infer things about the functions going on within. So it's kind of like a portable MRI. It's being able to kind of scan what your brain is doing functionally, very much like EEG. And with that, if you have light going into the scalp, there's melanin. And the people designing these technologies don't think about melanin. They think, okay, light goes in, it comes out, easy. But melanin is like, sunglasses over your skin, right? It's a blocker, a filter. And so there's all these phenotypic biases on the physical hardware. And now you also have artificial intelligence that has biases depending on who has made it. So now you have a hardware problem, a software problem, and you bring them together into this neurotechnological advancement, and you never know what can happen. And I 100% agree with what Catherine is saying about fear mongering. We don't want to make sure that people are afraid of technologies, that they might not work on me because I'm a Black person, for example. But it is something that still has a technical challenge behind it. It's something that they have not fixed yet. And so that's huge to me. Other dilemmas that I think a lot about are, access and, working. I grew up in the US and did my PhD there and everything. Now I've been, I guess, for a year now in Kenya. where my father's from, and it's access in terms of who can afford care, who can afford an EEG for their medical care, who can afford EEG for consumer tech fun, right? Because it's a huge thing in Silicon Valley that people buy EEG electrodes and they, try to see if their attention is better or if they slept well last night. That's really hot. But it's also kind of like a social access. Like, are advances in neurotechnologies that are happening friendly to the culture? And so do people think that there's superstition behind what's going on, or are the people in the community actually understanding what's coming? And that leads to something that I'm sure anyone who has any exposure to law and the like true neuroethics, they're thinking a lot about informed consent. Do we actually know what people are getting into when they sign up for it? And I think about this even in terms of social media. There's neuromarketing already, where you're signing up for Facebook, but you don't realize that they might be using your data for other reasons, right? And so without knowing exactly how your data will be used, owning your data, as Damien said, there's a lot of sticky situations. You have phenotypic bias, you have artificial intelligence bias, you have ignorance, you have lack of access socially, physically. It's a zoo. It's a zoo of problems. And I think it's doubly so here in the global South. And I can also speak to being someone from privilege in the global North, but also a marginalized person because I'm a Black person and African American in the United States. So, man, I could stay on this question forever because there's actually things that I haven't even talked about, but I'll shut up for now and then bring them up later.
Thank you. Thank you very much for bringing that to the floor, Jasmine, and for bringing up all these issues and speaking about the intersections between neurotechnologies and AI and how the bias on bias makes it even more complex and raises a lot more uncertainties. And who the technologies have been tested on matters a lot because it matters as to how they would or would not work, perhaps for different communities. So I would like to now pass over to Diego to join into the discussion and to share from his perspective around this topic. Diego, please take it away.
Well, I pretty much agree with everything that had been said. So first, taking some points that Damien mentioned, I do think we need to transcend and go beyond a colonialism thought in academia and regulation. So we have to do a real effort in our institutions, in the global south, in our societies, to stop allowing the global north to shape our own Latin American, African, and global south landscape. So, for example, in the neurorights discussion here in Latin America, it seems to me that some important universities and some very prestigious researchers of the global south are coming to the of the global north are coming to the global south, and we are still thinking in a very colonial mind, such as to think that everything that's come from the north is amazing and needs to be implemented without discussion and adaptation to our regional and our cultural context. And that should not be happening, but it seems to be happening, at least, for example, in Latin America. It's still a reality, especially present in any rights discussions. And also, what Catherine also mentioned, for example, what about the near hype that's revolving around the near rights discussion in Latin American countries? So let me give you just a very practical example. Some narrative of the near rights initiatives has said, for example, that there is a real possibility that new technologies are going to implant false memories. So, at the current state of the art, memory implantation by neurotechnological stimulation is not possible, and perhaps it won't be possible in the near or even in the far future. Memory implantation and memory creation is now possible with psychotherapy, for example, but not with neurotechnology. Uh, but it seems that, for example, here in the global software, we don't really discuss whether that is a true claim and where we should regulate. For example, now Mexico has a new legal bill that is being proposed and discussed in the Congress that has 35 different legal reforms, creates 10 new rights, and also creates four crimes. And one of those crimes is the crime against memory implantation with neurotechnology. So the thing is, uh, we are not really assessing the real claims of what neurotechnology can do. And we have reached a point where governments and politicians now have bought that discourse, and we are so worried that we're saying this is so present that we need to create a new crime against memory implantation in a country that perhaps that is never going to happen in the near or far future. So I think we as researchers in the global south have a very important role in defining what the discussions and the political discussions and regulations and academic deliberations should be. We have to transcend beyond that colonial view that everything that comes from the north is amazing and should be implemented without any discussion or adaptation in specific cultures. So that's a big worry that I have, and that seems to be happening at least uh, in the regions that I study here in Latin America.
Thank you, Diego. You raise an important point. Damien, did you want to jump in there? I see that you have your mic off. Please go ahead.
No. So I wanted to maybe jump in here and talk about some other things that have been talked about. And I like the discussion because sometimes when we talk about neurotechnology, some people think about the specialized invasive technologies, uh, but that's not actually the only neurotechnologies that we have. And I'm happy Jasmine is talking about EEG, which is neurosensing, MEG, FNIAS, or maybe fMRI or MRI, and not just deep brain stimulation or transcranial magnetic stimulations. But all in all these technologies produce enormous amount of data. And the data sets that they produce are maybe in the GDPR, we'll call it special category data. And if you consider the unique nature of some of these data sets, maybe they are even a step very close to genetic data. For instance, I'll give you fMRI or MRI has brain prints in them. And that makes it almost practically impossible to anonymize. So the brain prints in fMRIs or MRI maybe as powerful as fingerprints, or maybe more powerful than fingerprints. So, and it's difficult to anonymize these data sets. So that means maybe these people are talking about neuroexceptionalism or neurodata exceptionalism. Is it as exceptional as genetic data? So there's a special place in the law and also in ethical considerations for these type of data sets. And one issue, just as you pointed out, Jasmine, is informed consent. And in Africa, we know the informed consent processes and ethics review processes. I have two projects at the moment addressing this in Africa, and it's difficult to get ethics review boards to understand what is involved in evaluating these technologies at the moment. So it is an issue that we need to think about. But also there are so many other issues. Maybe I can talk about that later on. One is also the fact that our idea of brain technologies, they often challenge cultural beliefs about self and also identity and spirituality in Africa. Because in Africa societies, our understanding of personhood and of mental health are intertwined with spiritual or maybe communal understandings. Introducing these technologies may often clash or maybe have a tension between them and the sociocultural beliefs that we have. So how can these technologies be developed are communicated to align with these respect for local cultural norms and understandings. So there are so many issues that we can discuss. And as Jasmine said, I can be on this topic for ages, but maybe we can discuss it a little later.
Thank you. Thank you very much, David, for bringing all of those important topics to the floor. I think one of the key things that I'd like to jump back to, which is what Diego was saying, which is I think also what you're also speaking about, is around establishing the priorities for our contexts, right? I think, one of the issues that you mentioned is informed consent and really making sure that people understand what they're signing up for, as Jasmine said. But also, I think, as Diego was saying, around what is realistically going to be possible and happening, I guess, and available in these particular contexts. And also, how does funding get used in a way that's helpful for exploring questions and real ethical issues that are pertinent here. So questions around, invasive neurotechnologies like deep brain stimulation, which are extremely expensive. There's some discussions around whether that is the most appropriate way to be using funding to think about neuroethics in these contexts, or some of the really basic kind of requirements that people with brain and mental health conditions are already struggling with in terms of basic neuroscientific technologies. I mean, access to an EEG is really a basic neurotechnology, right? So I guess, I'm quite curious to hear your thoughts around that. I know that, Catherine has also worked a lot on implantable, looking at, requirements for neuroscientists after implantable neurotechnologies have been used in research and other non-invasive neurotechnologies. So maybe we could chat a little bit about that and then think about it in line with the priorities and what's more urgent, pertinent in this context.
Sorry, is that for me?
Anybody can go.
Okay. Go on, Diego.
Thank you. So Olivia has raised a very important topic, especially in our context, which is also, for example, access to technologies. So there is a special concern regarding neurorights initiatives on a proposal that is basically to create a new right called the new right to equal access to mental augmentation. This is a very important proposal because uh, the diagnosis of the problem is correct, and is, if in the future we don't regulate access to neurotechnology that enhance cognitive abilities, hypothetically there will be more power imbalances and now regarding cognitive abilities, for example. So just those with high levels of income can purchase those types of technology that augmentate cognitive abilities. But that's also a very important problem for the following sense. So first, proposing a new right to equal access to mental augmentation has ethical, conceptual, practical, and financial problems that we need to discuss before legislating in favor of those type of rights. First, an ethical concern is regarding whether we should allow and promote the modification of human nature. So we have had a very similar debate regarding genetic modification, for example, and the conclusion was to prohibit any alterations of genetics and the genome and human nature that goes beyond clinical or research or therapeutical applications. So we currently, for example, all the national and international frameworks regarding genetic modifications prohibit the alteration of human nature without clinical or therapeutical purposes. So a first discussion is an ethical discussion regarding, for example, the transhumanist applications of neurotechnology. Should we allow and should we even promote as a human right the alteration of human nature and the alteration of the human mind beyond therapeutical applications? A more practical concern regarding, for example, a right to equal access to mental augmentation is if we create a right that has that name in our constitutions that then becomes a positive right that requires a financial burden to the state? Should the states be financing new technologies that don't have therapeutical, clinical, or public health applications with public funds? So we have to take into account that current health systems don't even have enough resources to operate inside the therapeutic applications. How are we going to finance a new right that goes beyond therapeutical applications? And that also have many practical implications regarding access, regarding antinomies. So I think that this is an example of how we should really take serious time to discuss the scopes and the conceptual implications and practical implications and financial implications and ethical implications of the legislative proposals that we're having. Perhaps we should first focus on guarantee equal access to therapeutical, clinical, and public health applications of new technology, which is not happening right now, before we are thinking about augmentation and transhumanist applications of new technology. So the topic of access is really important, and is more important in our regions where we don't have really even the enough resources to fund public health systems and even to guarantee basic human rights.
Absolutely. Absolutely. I think that's a crucial point that you bring to the table. And thank you so much for highlighting that. And I'd like to ask Catherine to come in and weigh in on this discussion.
Yeah, I think I want to add probably another layer, probably before, at least this is more related to where I see also some of the concerns. Before also talking about full access to all, we should also look at currently in the ongoing research trials on some of the implantable neurotechnologies. We also see, for example, that there is a big issue of post-trial access. There are a lot of individuals that are losing this right, which in several international ethical guidelines, individuals that benefit from a particular intervention, including a technology, should be able to have an ongoing use or kind of retain the right to keep on using a certain device. And of course, we see that going back to what Jasmine was mentioning about informed consent, it is quite also a very difficult area to navigate. How are we ensuring that the individuals, before that they are getting into these research trials, are agreeing or are informed enough to have the ability to make an informed decision and go through a whole research trial, knowing that perhaps there is a likelihood that they will have to explant the device, or that they might not retain the ability to keep access of a certain device. And I think these are also discussions that I think are kind of also related to access after a certain technology has been accepted or has received approval from regulatory bodies. I think these two discussions are very much intertwined, and also especially that we are seeing that a lot of these research trials take place also in more global north countries and not in the global south. So we are also in that respect not having a full picture of how this will also impact countries and patient participants in the global south.
Absolutely. Thank you so much, Catherine, for adding that layer, thinking about it from the research realm and post-trial, post-study access, and if there are any complications to the person, who pays for that? How do they get the care that they need and the support that they need with that particular implantable device that they've now got from the research process? So these are all crucial neuroethics questions that that are important for us to be thinking about. I think I'll hand over to Damien to go ahead with your contribution, please.
Thank you. Just a quick one. I'm very glad you mentioned, Catherine, that most of these trials are happening in the global north. That's true. No. Most of these trials are happening in the global north. Sorry, in the place I am, and I'm leaving very soon. So, but some of them are going to happen in the global south, and there are possibilities of ethics dumping. So, where most of the things that are not permitted in the global north are then outsourced to the global south because of the lower ethical standards of the processes. So it is important for us, both as researchers and also as policymakers in Africa and in the global south, to understand that there will be possibilities of ethics dumping, because history tells us that most unethical trials or drug trials and everything actually happen in the global south.
Sure.
Or in Black people and in the global north.
Sure.
Yeah.
That's something.
So
go ahead, Jasmine.
That's huge. I wanted to add to this, and I do come from the world of I think about neurotech as like the non-invasive stuff, and so maybe my perspective is a little bit limited there, but I think it's useful anyway. So I if Diego's talking about access for everyone and Catherine's talking about take a step back, what about during the research? I'm taking a step back before that, which is just education, our pedagogy in the global south. Like how and who are we teaching? The whole problem with EEG or FNIRS or all of these kind of scalp-based or like skin-based technologies is that they're developed in the global north. They're developed with people with fair skin and straight hair for people with, it's for us by us, FUBU. That's what it stands for. So, I mean, I think about this all the time, how Hans Berger created EEG literally 100 years ago in 1924 at the rise of the Nazi, Germany era. And though we can't really tell what his thoughts or beliefs are, you can imagine if your funding source cares a lot about your local community and not about the entire globe, the things that we develop will not be accessible to everyone. So again, this is more relevant to the more phenotypic biases that we see. But I recently picked up Pedagogy of the Oppressed, the book from Paulo, I don't know how to pronounce his last name, Freire, I think. And his idea of education, and this could be anywhere from music education to science education or whatever, is you're not just telling people this is how engineering works, this is just how neuroscience works. It's about making people understand from their lived reality what is needed, and then you can invent and create from the place where you are in the world. And for people who are oppressed, which I would say are the majority of the people in the global south, there's a lot of ideas and understanding that you can get from critically looking at your world and thinking, how can we make it better? And I don't think the funding bodies certainly have not empowered the global south to do that, right? Because it's a benevolence that the NIH is giving Kenyans, money, right? That's a big problem. But in order to defeat that mindset that technology will just fix everything, or that the global north has given us this amazing product, we should use it because it will fix our problems, you have to empower, in terms of pedagogy, in terms of education, the people who are in the regions of the world that we're in now, right? We need to make sure that folks, children especially, who aspire to leave their nation to get education, actually look around at their world and think about it in terms of like, wow, we actually have so much to do, and not take a blase approach. The most shocking thing that I found here is that I was bringing these electrodes that work with braids, and it's this like, Afrocentric approach to EEG. And I was so excited with my American hat on, like, yeah. And the neurologist I was working with was like, I haven't had an issue with hair in EEG. And I was like, oh. And I was thinking, oh my gosh, this is one of those moments where me, the American, I'm bringing some solution that's not needed to a place. But then we met in a couple weeks, and that same doctor was like, actually, we totally have issues with EEG. We just don't think about that as a systemic problem. We think, there's always problems in medicine, so you just work around it, and that's fine. And I was like, oh, so there is something here. It's just, you just accepted that this was a problem instead of thinking, actually, other people don't have this problem. And that's an exposure and access and education thing, perhaps. The jury's still out on if my product is necessary in Kenya, but I digress. So my point is really just about education and making sure that, especially when it comes to the engineering mindset that I have, who are we designing for and who is allowed to design, and beating techno-chauvinism, the idea that technology will save us from our problems. Okay, I can again ramble forever, but I'll stop there.
Thank you, Jasmine. You bring an important point to the table around education and how we go about it. And I think that actually is a great segue to invite the audience to please do either raise your hand if you have a question or pop a question in the chat as the discussion is ongoing. We'd love to engage with any of your thoughts, any of your ideas, any of your questions, suggestions, or comments as the conversation is moving forward. I haven't seen any in the chat as yet. Just an acknowledgement of how your different perspectives and backgrounds actually are very interesting to hear about. And I think that's the fascinating thing about neuroethics, is that you can come from philosophy, you can come from neuroscience, you can come from law background. There's a lot of, interesting insights, and the vantage point that you come from adds something to the discussion and a different lens that I think is important to take forward. So I see 2 hands up, and I'm going to start with Professor Jantine de Vries. You can go ahead.
Hello. Hi, everyone. Thank you for your conversation. My name is Jantine. I direct the EthicsLab and link to Olivia in many different ways. So thank you for taking the time. Very lovely to hear your conversation. Really interesting kind of reflections and ideas. The one question that I'm going to ask is not an easy one, but it's an important one. Many of your kind of reflections made me think quite a bit about boundaries and whether boundaries are necessary, whether they are, and how solid the boundaries are, and whether they are permeable by necessity or by intent. And what I mean there is that I find it quite interesting. You all speak to ethics in different ways, but also in very different ways. So sometimes in your discussion, ethics is about consent. Sometimes it is about fairness and justice. And so the question that naturally came to me is, what do you understand ethics to be? So the boundary here is about, where do you place the boundary around ethics, right? What is ethics in your discussion? The second kind of boundary that I think was coming up in your discussions is, what is Africa you speak of? Now, Diego, I know that you don't pretend to speak to Africa, so this is perhaps a question more to, Olivia was asking the questions, but Olivia, Damien, Jasmine, maybe Catherine as well. I don't know exactly what work you do, but what is the Africa that you speak of? And this is a question that I think people in the African studies tradition often ask, right? What is the Africa we speak of? What is, for instance, Jasmine, in your example of hair, whose hair are you speaking about? And so I understand it, but also, what is the assumption that you make about Africa? And how does that then change our discussions? There's a certain, sometimes geographical boundary, sometimes an intellectual boundary, but there's another kind of boundary work that is happening there. And then the third kind of boundary, sorry, speaking about for quite a while, but the third kind of boundary is around neuroscience and neurotech. So Catherine, for instance, I noticed that you were speaking about the young boy who sadly committed suicide after an interaction with an AI bot that seemed to at least somehow encourage suicidal thought. Now, to what extent is that an instantiation of AI? Is that an instantiation of neuroscience? Is it a neurotechnology? Is it all of that combined? Is it something in the realm of psychology? So again, I was asking myself, what is the neuro here? Like the neurotechnology, the neuroscience. And that might be an instance where the boundary is deliberately permeable, right? It might be that this is a technology that cannot be bounded. So that's 3 different boundaries. And then I guess the fourth one that I encountered was about neuroethics and how neuroethics is distinguished from other forms of bioethics, and whether that is deliberately permeable. Is it separate? Is it an extension of other ways of thinking, and so on? So my questions about boundaries, and I think all of you spoke about these things in different ways. And so I'd love to hear your reflections on that rather provocative question.
Thank you,
Maybe
Professor.
maybe I'll go first. I'll
Yes,
take
please
the
go.
philosophical question first of ethics and neuroethics. So neuroethics is a form of applied ethics. And just like bioethics or computer ethics or any other type of applied ethics. And as an applied ethical or discipline, it applies some of the foundational or fundamental ethical principles of autonomy, of justice, of malfeasance and non-malfeasance. So it is important for us to understand it also in the context of traditional ethics, right? So it is an applied applied ethics that focuses on just the ethical implications of neuroscience and neurotechnology. So the boundary there is the focus on neurotechnology and neuroscience. And that's where you can draw the relationship between neuroethics and other and bioethics. Bioethics, I will also say that neuroethics is maybe sub-applied discipline in bioethics because it also deals with if we understand neuroscience as part of biosciences, it is also part of bioethics. So, but here, the focus is just on ethical implications of neuroscience and neurotechnology. And that's why we are also talking about informed consent. Informed consent touches on autonomy, it touches on harm, it touches on most of the traditional ethical issues. So that's also why it is important here. And because neurotechnologies also deal with fundamental biomedical research, but also it also deals with data collection where informed consent is needed. So the boundary here is just ethical issues and dilemmas related to neuroscience and neuroethics. I don't know if that answered that.
Thank you, David. I think let me hand over to Catherine to also give it a go, and then Jasmine, and we'll take some other questions thereafter.
Yeah, so I'm gonna focus. Thank you, Gentina, for your question. I think I'm gonna focus on more when you were asking about neuroscience, neurotechnology, and that example of that AI chatbot. And I think maybe we can start with, what is neuroscience, just to kind of give a definition and to see how these other tools are incorporated within, I would say, the bigger scope of neuroscience. So neuroscience is the science of investigating the brain and the mind. And of course, neurotechnology is one way that we could investigate the brain and mind, one way where we could improve certain cognitive capacities, certain brain functions, certain behavioral outcomes. And there's this very nice we are seeing, of course, nowadays that these boundaries are actually no longer existent between different fields, between different practices. So neuroscience today works together with psychology, works together with behavioral sciences, works together with AI as well. And for example, we know, and this is I love this statement a lot. They say that neurotechnology on AI is neurotechnology on steroids. So it is still neurotechnology. It is still working towards improving the brain, improving the lives of those that are suffering from certain debilitating neurological conditions or psychiatric conditions. But it just kind of expands, or the effect becomes exponential because of this very strong capabilities and impact of AI. And I think when we look at particularly at this example of AI chatbot, of course, some people might not consider it a neurotechnology at all, and I can also understand this criticism. But I think at the end, when we're looking at what is this AI chatbot trying to impact, it's the psychology of individuals or those that will be using it. It's the mental health of individuals that are going to be making use of it. So then I think the fields have to work together in order to try and see what is the best way to advance such a technology in order to become an effective intervention, an ethical and responsible intervention for those that are suffering from mental illnesses, but also for those that seek it in order to prevent the exacerbation of certain mental concerns. So I would say that this question of boundary becomes, of course, more complex the more we start integrating different technologies together.
Thank you, Catherine. Jasmine, let's go ahead.
Yeah, I'll try to keep it brief. I fully agree with Catherine. These are complex and rich questions. You're asking a lot of us in one sitting. But I mean, I think from the people I've spoken to at the Harvard Center for Bioethics and other professional ethicists, I've noticed that like my engineer brain is a little too, like, it's not as theoretical as most people. So I cannot answer from a theoretical like point of view of boundaries. But I also would like to say that like, maybe this is going to get into some like weird territory. Forgive me. Science is not inherently apolitical, and it never has been. And so when I approach all of the 4 questions that you posed, I come from a very like, maybe I shouldn't say self-serving, but from a political point of view. When you ask what is the boundary of what is Africa, I'm an American with African ancestry, right? And so I think about the marginalized people in the US. I think about the people who don't have all of the rights that should be bestowed upon Americans with the freedoms and all of this, right? And so when I think about Africa, I'm not thinking about downtown Nairobi, I'm thinking about even the village, right? The folks who I can't even speak with because they don't speak English. I'm thinking about the margins, right? Those are the people that I'm thinking of. I'm thinking of the darkest skinned people, the people with the coarsest hair, right? So that's my political approach to Africanness, if that's part of your question. And then so it makes sense to me then that ethics and neuroethics have to be about justice for those oppressed or marginalized people, right? And so I think, you know, as Catherine said, it's a highly interdisciplinary field, neuroscience and neuroethics and neurotechnology. I would maybe define neurotech as like tools for discovery, but also tools for enhancement, or what would it be called when you're taking someone with a deficit of some sort and bringing them to baseline, whatever that might be. And so to me, all of this comes down to what is the justice of the matter? Are people having the same access and opportunities as others? And do they have the knowledge and tools to, from a place of education, self-determine? And so that's my approach to it. And it doesn't matter if it's invasive or non-invasive, and it doesn't matter if it's a collection of positive rights or negative rights, words that I had to look up. You know, it's really helping the people who are the most oppressed in this historic system that we have set up. So that's my approach.
Thank you, Jasmine. I think this is a great group of people because I think you are pushing into certain territories and spaces discussions that we don't often have when we think about neuroethics, and I think that's what we want. So thank you for bringing that to the floor. I'm going to open it up to Diego, and then we'll hear from from Gentina if she's happy or if she has any follow-up questions to this discussion. So thank you. Go ahead, Diego.
So defining the boundaries between fields, it's a very complex endeavor. I almost always try to avoid getting in that discussion because I don't really have many interesting answers to give. But I understand, and I have a rather open definition of neuroethics as the study of the ethical, legal, and social implications of neuroscience and neurotechnology. So this is a really open and broad definition of neuroethics, because a restricted definition could leave or could reduce the living spirit of our field. So a problematic point of that definition is when we say the legal implications of neuroscience and neurotechnology. So almost neurolaw in some aspects is a logical consequence of neuroethical discussions when applied to law. So really the boundaries between those, at least those specific fields and many others, are, uh, are, are reducing as inter and transdisciplinary analysis becomes more and more important. So, for example, I understand for its part neurolaw as the generic field of of the relationship between neuroscience and law, specifically applied in three fields, which is revision, assessment, and intervention. Which basically revision is how neuroscience should lead us to revise, change, or adapt legal norms. Assessment being that the law cares about mental states and evaluating mental states, assessing mental states, and intervention as being perhaps those discussion when neurotechnology becomes a tool to intervene in legal and judicial fields. And for example, the main neuroethical discussions currently, I think, are the problem of consciousness, brain data and mental privacy, autonomy, identity and integrity, cognitive and moral enhancement, neurodiversity, and what also Catherine mentioned on neurohype and neuroessentialism. So I don't really have a very uh, clever response to your very complex question, but I think perhaps those are my definitions, and I do really think it's a very hard, difficult uh, problem to solve. But yeah, it seems that the boundaries currently in the fields are becoming less and less important when transdisciplinary analysis is taking place.
Thank you. Thank you very much, Diego. And I'm also thinking around the lines of, I'm quite curious as to, why we do need to define the boundaries because it's such an interdisciplinary field. So, I'm happy to have that discussion offline. I don't want to take off too much time from this conversation, but I definitely do want to open it up to hear if you have any follow-ups or any feedback, comments on that, Gentina.
I know, because I see there's other hands up. I just want to point out boundaries work both to keep people in and to keep people out. And so obviously there I'm referring to older work by somebody called Thomas Guerin, who very articulately mapped how scientists constantly keep people in and out, and there are stakes. I mean, Jasmine, I agree completely. Science is political. And so when the boundaries are drawn, when we think about ethics as principlism, as Damien did, for instance, what is it that we are doing and what are we keeping out? I just think it's a really interesting question. And it's not an easy one to solve. I mean, it's a provocative question, but it's a very helpful question for us to think, I think. So, and never apologize for being a scientist, Jasmine.
Thank you. Thank you very much. So I think I'm handing over to Anya to please go ahead with your question. And I see the questions in the chat. After we address Anya's, we'll be jumping onto those questions. Thank you.
Yeah, thanks, Olivia, and thanks to Catherine, Jasmine, Diego, and Damien for really stimulating insights. And I think I hope this lands, but there's at least one question in the chat that I want to sort of piggyback on, but also push Yantina's question about boundaries in a different direction. And then the third thing, I'm trying to do three things in one. And then ultimately, I think link that question back to a more specific question directed at Diego. So, and I think the piggybacking of the question in the chat room will come at the end when I'm making the direct question to Diego. But I guess the general, I mean, I'm just interested in how certain things come to be an issue in this field as someone who is not in the field of neuroethics. And so the general question is just how how do things come to be neuroethics issues, such that the brain becomes the appropriate site of intervention. And so it's both, I guess, I'm both asking for a restatement on your end, to whoever is interested in this question, about the kinds of things that have come to be neuroethics issues in neuroethics, and how and how and why, and just the broader historical construction of the brain, as you know, where you need to make an intervention, as opposed to other areas where you could make an intervention. There's a sort of kind of boundary work that happens there, right? So the the yeah, human biology as a site where you make sort of these kind of interventions. And that's I think that's a why question, right? And so the link I'm trying to make with Diego's contribution is, I was always struck by the fact that the Global South was the leader in this neurorights discussion, especially in terms of your observation that it's an important agenda. So I'm curious, why is that the case? Why is it that Chile, Brazil are like pioneers in this area? What are the conditions under which neurorights comes to be the thing that, you know, that sort of dominates the conversation? I'm genuinely curious why, and I think, and then I think that there's a question in the chat room about whether or not, you know, you do find an audience for, you know, this call to be more reflective um, about, you know, uncritical adoption of Northern agendas in your own encounters in sort of legislative context. So yeah, I'm just interested in why the brain, but also why neurorights? Like, why is that the thing that, and how does it come to be that, you know, that's that there's this sort of, how does it come to be that there's this big existential threat? The brain is the last frontier of human freedom that we need to protect. Like, what are the conditions under which that kind of framing is possible?
Thank you, Anye. Diego, would you like to go ahead with that very quickly?
Yes, sure. So, regarding the second question, perhaps there are many reasons why specifically Latin America has been the pioneer in the near rights discussion. But something important is that um, it's important to state that this seems to be perhaps not real, not a reality. So Latin America has around 20 new rights initiatives across Mexico, Chile, Brazil, Colombia, Uruguay, and others. But of those almost 20 initiatives, just 4 have been actually approved. Of those 4, just 2 of those 4, 2 are soft law approaches, which means basically that they're non-binding, non-legally binding. So it seems to me that there is a real political interest to create initiatives, but not really to support the actual implementation of those initiatives. So it seems that politicians just want to take the picture and say, look, we're creating bills and proposals to save the world from dystopian neurotechnologies that are going to control or read our mind, but there isn't a real political compromise in materializing those initiatives. So, for example, Chile, that's the pioneer and the first country in the world to legislate. Well, Chile hasn't really done that much. Chile, 4 years ago or 3 years ago in 2021, approved a constitutional reform, which basically is just a paragraph, a short paragraph that says that science has to be in favor of humanity and that they protect the brain activity and the psychological integrity. But they didn't really do that much beyond that. So there was a legal bill, for example, proposed in Chile that really was never approved. That it was supposed to be the actual regulation, and it was never approved. So Chile also have, for example, the first legal constitutional case in the world against Emotive, which is a very important neurotechnological company. But the case also wasn't a real case of a citizen being violated by his rights being violated by the company, but rather that legal case was actually of the senator that proposed the new rights in Chile. So he consciously bought a new EEG from Emotive. He consciously acquired a free license, and he consciously, after doing those two steps, well, sued Emotive. So it wasn't really a case of a citizen rights being really threat in practice. So it seems to me that one of the reasons we have led this discussion is because specifically the Neurorights Foundation, led by Professor Rafael Juste, has created a really interesting political structure. And I'm going to be really fast because I'm taking so much time.
Diego, you have
The
30
new
seconds.
Thank you. So the reason is because the New Rights Initiative, in practice, has a political structure, contacting NGOs, politicians, and universities, and that's why we have so much bills. But in reality, we haven't really done that much in practice.
Thank you. Thank you very much, Diego. Quickly, Catherine, you had your hand up. I'd like to give you an opportunity, and then just quick last words from everyone before I hand over back to Anya to close us off. Can we please answer some of the questions in the chat as well? I think we've done a few of them, but while you're going ahead, Catherine, I'll also attend to those.
Yeah, I think it was for the first question of Anya, and that was just very briefly to say that yes, I mean, neuroethics has been criticized as a field, as in what does it bring new to the table that bioethics hasn't? And of course, neuroethics makes use of a lot of bioethical principles, bioethical scholarship in order to better understand several questions or to tackle research questions that are associated with neuroscientific research and neurotechnology. But of course, when does it become really more neuroethics is when we are discussing technologies or scientific research that is really focused on ways to read the brain, to manipulate the brain, and to modify the brain. And of course, why? The question, why the brain? It's because for a lot of us, if not all of us, the brain is a very special organ. We identify ourselves with the brain, and so it has, of course, a very special status. So this is why we, I think, also to kind of make use of Jantina's remark about boundaries being to keep people in and keep others out. I think also very honestly, the way I see neuroethics, it's also a field to get people together focusing on similar questions and for them to find each other. And it's basically that at the end of the day. When we have international neuroethics society meetings, it's really for us to get together, share insights about some of the work that we are doing, not necessarily to exclude anyone, but also just to kind of keep focused on the similar questions that arise in relationship to discoveries and advancements in neuroscience and neurotechnology.
Thank you very much. Jasmine?
So I thought we were going to run out of time, so I didn't, in my brain, prepare any remarks. I guess I could say that I think the reading and writing, I think, of the brain in general is a huge thing. I also will add that I think your reading and writing, even with psychological things, like kind of as Catherine was saying, with large language models and ChatGPT and all of this. So I think the realm of neurotech actually extends quite far, because you can be influencing someone's brain just by doing A/B testing, and that's been in use since the internet existed. You give some people one version of a web page and you give other people another version of the web page, and you look at their behaviors and realize that they're going to buy more shoes on this version. That is an influence on the brain. So that's my small remark on top of what Catherine's saying.
Thank you. Thank you very much. Damien, please. I've also just popped everyone's papers in the chat, so you're welcome to read some of their work. There's a nice chapter here on introduction to neuroethics and bioethics that Catherine has also written with Professor Judy Ellis as well, in the Developments in Neuroethics and Bioethics book. So I'd encourage you to have a look at the links when you get a chance, and read up more and stay involved in the discussion. So thank you. Go ahead, Damien.
Yeah, I just wanted to maybe make a last comment on a question in the chat, talking about the fact that most of these technologies are also developed, designed by resources mined or extracted from Africa. That's true. And that also shows or amplifies the fact that most of these technologies can have some colonial tendencies in them. And one thing I've been proposing both in AI and also in neurotechnology now is to think about decoloniality as a requirement for trustworthiness. For us to, in Africa, maybe in the global south, to trust AI technologies or maybe neurotechnologies, we need to think about how these colonial tendencies can be mitigated before we use them.
Wonderful. Thank you so much, everyone. It's been such a pleasure, and I hope that we'll continue these discussions going forward. I would like to hand over to Anye to moderate, please.
Thanks, Olivia, for an excellent moderation. And I'd like to thank our speakers as well, our panelists, Jasmine, Diego, Damien, Catherine. And just to again reiterate the intention of the webinar, it's meant as, at least we intended it within our own sense of our trajectory here in the lab as an exploratory conversation. I can see from the chat room that there's a real appetite and growing interest for these kinds of conversations on neuroethics. It's great to see that there are really many diverse points of entry, and I think I'll probably just conclude on. I do think that Yantina's question about boundaries is really it's important because it does show. I mean, I think Catherine, you as well emphasizes that it is a neuroethics is a house of many mansions. The boundaries are very permeable. I mean, we've talked about the therapy enhancement, dichotomy, issues of bias, access, justice, the role of the state and state responsibilities, relations and institutions of colonialism, imperialism, and resource extraction, racism, equity. So I get the feeling that there is a potential to really stretch the boundaries of what we put in the box that we call ethics. So I'd like to thank all our speakers for really insightful contributions and in that regard. And I'm really excited for, opportunities for more conversations in future. Thanks to everyone who gave up their afternoon or their early morning to join us. And this event has been recorded and we will be sharing it both on the EthicsLab website and then at the Genomics of Brain Disorder Unit's website. So thank you to everyone and have a good rest of your day or rest of your evening.
Thank you so much, everyone.
Thank you.
Thank you.
Bye.
Bye.
Bye. Thank you.